appearing to or having to take political sides, and so it tends to be that kind of issue, and I can't talk about it very much without being fairly transparent, and so I think that one of the unfortunate failings of our American culture is our healthcare system. If you compare our healthcare system with virtually any industrialized nation, they think that it's fairly absurd how much people have to pay out of pocket for various things. And as a consequence of how costly it is, there are many, many, many people without health care, and that the Affordable Care Act, by their very name, indicates is supposed to make it affordable to the vast majority of Americans. And so the 2014s are working in Appalachia and dealing with people primarily on environmental issues, but the people they're dealing with also have a lot of social class issues. There's a lot of poor folks that they're dealing with, and the Affordable Care Act would be something that would benefit them generally, especially as they deal with some of the chronic and very debilitating diseases that can come with the environmental impact of the coal mining industry, black lung disease, for example. And of course, another example, a bad example of a need up there is treatment for and dealing with various substance abuse, OxyContin, meth, etc. And so, the Affordable Care Act is something that is very important to be able to reach as many people as possible with health care. The biggest thing I see, not the biggest thing, but one of the bigger things that I see is how this impacts children. If I'm a parent making a decision between keeping the heat on and taking my son or daughter to the dentist, for example, I've got to keep the heat on, and we can't go to the dentist, or we can't go to the doctor for this or that. There's a chronic suck-it-up attitude. We can't afford to go to the doctor, so just suck it up. And we all know that an ounce of prevention is worth a pound of cure. And so what happens is that what to you and I in middle or upper middle class circumstances would be just a very minor kind of problem, because we will deal with it out front aggressively, ounce of prevention kind of model. If you are in the lower socioeconomic classes and don't have access to health care because you don't have insurance or whatever, those small problems are going to turn into big problems. It's going to take a pound of cure to deal with something that you and I, again, would just take care of very quickly. So that's Arcaro's kind of read on the necessity for the Affordable Care Act. Having said all that, I apologize. Having said all that.